talk of the year, because this is the last day Ella and I are working together of this decade. You don't care. I'm excited because I got to say decade. It's because my daughter's
on vacation next week.
Yes, you're on vacation next week, and then I'm on vacation the following week, so we won't see each other again. So we thought we would take a couple minutes real fast and just to, feel free to ask questions during this or whatnot. And we thought we would explain to you why a diagnosis is important when we're trying to figure out what's going on with your pet.
So, you mean like versus a Google diagnosis? Like an actual diagnosis?
I like real diagnoses, and I like it when I can get one in the clinic. And whether you sort out if it's a Google diagnosis or you just come in and you're like, yeah, let's not do those tests because we don't really need the test. I'm just going to treat the symptoms. That might not be the best case. So, Ellen, real fast, why don't you tell us what a diagnosis is?
Oh, thanks. Well,
you were looking it up earlier.
I was looking it up earlier. It's very complicated.
It is.
Essentially, a diagnosis is what your pet has. Like, the doctor has to figure out this puzzle, put all the pieces together and go, aha, your pet has this. Now we are going to treat it this way. The problem is that so many diseases mimic each other, so they have to put these little pieces together and fine-tune it and filter out all of the information to kind of get the one answer we're looking for. Now, the problem with a diagnosis is it might be a broad diagnosis, it might be a very narrow diagnosis, it might be an open diagnosis.
Right. Open
so you have all of these different types of diagnoses. That's why it was one of the things that we say, please do not use Google to Google your pet's symptoms, because you will get everything from panleukopenia to IBD to rectal cancer on some of these cats that have bloody diarrhea. And I'm sorry, I mean, it is scary out there. And there's so much misinformation out there. And that's why it's so important when you see your veterinarian, they actually start putting all the little pieces together by all the various diagnostics they are going to do to create a true diagnosis. This is what is wrong with your pet.
Right. So, to go further about what Ellen said, I was thinking the best way to do this would be to use an example. So let's just say your cat has diarrhea. Say it's a newer kitten that you've recently adopted and it has diarrhea. And you bring it into the vet and you're like, my cat has diarrhea. Everyone says, okay, did you bring a fecal sample? You're like, here's the fecal sample. Do I actually need to run the test? Now, here's what I will say. Your cat has a sign, a clinical sign of having diarrhea. We can treat the sign. The sign is a sign of the diagnosis. So, I have diarrhea, or I don't. The kitten has diarrhea. It could have multiple different diagnoses that cause diarrhea. It could have roundworms. It could have hookworms. It could have woodworms. It could have coccidia. It could have giardia. It could have a motility disorder. Mm-hmm. It could have some type of weird blockage. It could have an anal gland issue. It could have a liver issue. I could keep going and going and going. Mm-hmm. So that one sign could have lots of different diagnoses attached to it. So that's why I would say, yes, we should do that diagnostic test. So say we send off the fecal.
So you prefer not to just treat symptomatically?
I prefer not to treat symptomatically unless we can't do diagnosis.
Or under an assumption.
I always prefer, I feel like most doctors and most medical professionals prefer to have a diagnostic answer or a diagnosis, because then there's lots, and then some of these diagnoses have lots of different treatment options. It depends. So say, for example, I'm trying to use something easy. Say this new kitten has roundworms. Okay, so let's pick out a treatment for roundworms. Okay, so let's go through, let's say we're just going to use our good friend Pyrantel or Strongyne. I used to work with this veterinary assistant who was from Romania, and she would say Pyrantel instead of Pyrantel. It was so elegant. It's like this gross yellow stuff, so to make it sound elegant is pretty funny. So we would get, say we do a couple treatments of Pyrantel or Strongyne, and then a couple weeks later, we retest to see if the roundworms are gone. Say the diarrhea's gone, the kitten's doing great, there's no more roundworms, done. Great. There's lots of different ways to kill roundworms, though. So just because we have the diagnoses, then we could have lots of different treatments. And again, this is an easy one. I'm not even talking about the cat that comes in, that's lost weight, that's not eating well, that's vomiting intermittently, that doesn't have a fever but just doesn't look right, isn't playing, is hiding. That could be a whole host of things.
Right.
And we would need a whole host of medical tests to try to figure out what the diagnosis is.
Right, and I think that's where a lot of people get frustrated because then it starts getting expensive. It's expensive, believe me. We're horrified by sometimes of the diagnostic costs, even on our end, of certain tests. But sometimes it's the only lab that offers that test.
Right.
And they're the only lab in the United States that does this specific test, and we need it done. I think also, like, a lot of people don't realize that, you know, sometimes there are certain drugs that you can only use with a certain age, like particularly like ranitidol for the treatment of trichomonas in cats. Like, you cannot use that in kittens because it can be so neurotoxic. And then some cats, regardless, is neurotoxic anyways, and then like you're almost like screwed because you don't have it. That is the only treatment option right now, other than letting this poor cat's GI tract try to figure it out itself, and therefore they're a carrier for the rest of their life. And like tritric is one of those the diarrhea problems that you have to like get a butt wash to actually like do this test properly. So you just can't bring in a sample. It has to be the freshest of the fresh sample.
I usually try to make Ellen get it.
Yeah, thanks. I enjoy doing those. And then hoping maybe you have got some of that protozoan in that sample. So sometimes catching it during whatever phase of the life cycle they're on can be tricky too. So even though we're treating for it, and then we come back and we do another fecal again, and they would be like, I thought you said this cat was negative. Well, fun fact, sometimes you have to treat the problem more than once. There's no, like, once and you're done with a lot of these medications.
Yes, and that's why for some of the medications, that was a great example. That drug is a great drug at killing tritric. It is not a good drug if you're the one taking it. It can do a lot of negative things to your body. So that's why we don't just treat with it. There's some things where we're just like, you know, you might have lymphoma, you might have IBD, you don't want to do further testing because it's not going to make a lot of changes on your end at the end of the day, and you want to treat with PRED, that's your prerogative. We understand. A lot of people do that, and that's fine. But for some of these drugs where, you know, it might not be a good idea to just use a steroid. It depends. This is why you need to have a conversation with your veterinarian. And that's why we really like to, when we can, get a true diagnosis and not just treat the symptoms. Often we will just treat symptoms because that is what makes the most sense with the client and the patient at the time. But ideally, when you can get a diagnosis, then you can figure out the best medical treatment. And at the end of the day, we want to do what's best for that pet on that day with that owner.
And like, let's take another example of like the coughing cat.
Oh
my God, there could be so many things wrong with a cat that coughs, you know, and everyone's like, it's just a hairball. Well, you know, fun fact, it's usually just not a hairball, okay? It could be asthma, it could be heartworm disease, it could be lungworms, it could be a whole host of other problems. And so like when the doctor actually physically does the physical exam and goes, I think we need an x-ray, and I think we need to run this blood panel specifically to look for this, and this. What that does is it creates a rule-out list and they check off the boxes. Well, it's not that, it's not that, it's not that, and therefore your little algorithm starts becoming a lot smaller, and then it's like, yes, it is feline asthma, or nope, it is this. You know, we're running into these problems. Or you can take an x-ray and then walk around the room and be like, have fun with that conversation. Because like sometimes when we take the x-rays and we look at them, we're like, wow, you know, this poor cat has a problem. And so like maybe that algorithm went that way because it wasn't something that wasn't even remotely on our list because that cat wasn't following the trends of a coughing cat.
Right, and that's a really good point because this is a great example because it is exceedingly rare, especially in our part of the country, for an indoor cat to get heartworm disease. But I tell you what, if you don't run that test on that coughing cat, doesn't matter what else you do, if that cat is positive for heartworm disease, nothing else matters because you need to take care of that disease. Because it's still going to cough. It doesn't matter what else you do, it's going to cough.
And then
that's
sometimes if they don't,
you need to do all of those additional tests.
And if they don't respond to the treatment that say the client's like, no, I really want to try steroids and stuff, and they don't respond. Well, you're gonna get stuck doing the diagnostics again and then doing more on top of it. So it's not like, there's always the option of like, well, we can try, and if there's no response, this is the next step of the plan. So it's still quite complicated. So I feel like, when the public's like, you're just out for our money. No, it's actually because your patients can't talk to you. And we actually need to do these diagnoses to actually tick off the boxes to make sure that you're treating appropriately. Because a lot of these cats are super sensitive to steroids, or the steroid might be the completely wrong choice, and now the cat's having an adverse reaction versus a reaction that's appropriate, or a response that's appropriate for it. So, it's not like we like to run tests because we like to run tests. It's because, the cat can't tell us the symptoms of what's going on. Sometimes the client isn't very thorough in actually describing what's happening.
Or they're thorough for when they're home.
Right.
I'm not home 24 hours a day staring at my cats.
Right.
They wouldn't want that.
Or there's a disagreement in the family. Well, no, I really think it's this. It's okay. Get on the same page, please. That's what we want. But
and the cat might not be coughing as much as because he coughs at night when you're asleep.
Right. Or the coughing is actually trying to vomit.
Right.
It might be something completely different. So there's a very difference between a dry cough, a wet cough, a trying to vomit something up cough. So, when we're in the room and we're actually physically like going through the motions and describing it for you, when we actually will get, okay, look, I'm gonna look like the vomiting cat for a moment, and we actually start saying, does your cat do this? We're trying to get more information from you on that, because if the cat is treated inappropriately, well, we're not even treating the disease that you're looking for.
Yes, and another thought is that I was thinking when you were talking about the cat that might have asthma, or the coughing cat. If it is asthma and we start treating with steroids, we can't go back in time and get a blood sample and test for allergies. I mean, some people like us will freeze it. Like I always say, like, get lots of blood tubes and then we'll freeze them before we start the steroids, so we can see in the future, like, is this an environmental allergen?
Right.
If it is, that'll change the course of the asthma.
Right.
And we can do things about that. But if we don't do that and we just bypass that step, then that's going to change the course for the cat.
Yep. Or now you're using steroid, and it actually the treatment you needed a non-steroid, and now we have to wait for this long washout period to be able to use the appropriate medication. So there's a lot of contraindications on top of it.
Yes, it can be. And that's why it's sort of like, if we're going from A to C, it is best to go from A to B to C, but sometimes we can't do that and we go like this. And if we could just make it a straight line and do things in the right order and the right way, it's better for everyone.
Right. So then let's talk about another complicated diagnosis. So,
no.
well, no, wait, because I'm going to bring this up because this actually is a good. So let's talk about Egbert, right? So Egbert.
Real fast, for those of you who don't know, Egbert is very, very cute.
Yes,
and he lives
cute.
with Ellen right now, and he will be up for adoption at some point.
Actually, he has home pending.
He does? I didn't know that.
He'll be going to San Francisco.
Oh, that's far.
Yep, out to my friend Ashley, who's at RVT out there.
I didn't know that. Congratulations, Ashley.
Yeah, so he'll be going out there when I can get him walking more.
That makes sense.
So we have a year to do it. So let's say his diagnosis was still, like, it's pretty open still, because he had progressive onset of paralysis, took him to neurology. They're like, it's not an injury, I don't know what it is. They disagreed that, the cat wasn't painful. We thought the cat was extraordinarily painful because he, like, exceeded the Glasgow scale for pain.
Yes, for those of you who don't know, the Glasgow pain scale in feline medicine is a really wonderful resource. If you want a link to that or anything like that, let us know. I'm pretty sure it's on our website, which is novacatclinic.com, but it's a great way to kind of go through this checklist to see and to quantify how much pain a pet is in, and it also has a facial recognition that Ellen was pretty big on helping them create the face.
Right, it works in neonates too. So, like, when I came back from neurology, completely frustrated. Believe me, I'm in veterinary medicine. I was genuinely frustrated when I came back from that visit. Explained what was happening. I wasn't happy with the open diagnosis, and I was given a poor prognosis with an open diagnosis. So that's really confusing.
So a poor prognosis means that it's probably not going to do well. He doesn't have a very good chance of doing well. And then an open diagnosis is just like, I don't know what it is.
Right.
I'm sorry.
So
it's
that was so
because we're
frustrating
not sure.
for me because I got like two ends of the spectrum. Like, I basically was told, like, whatever, he's not going to get better. You might as well, like, euthanize him. That's how I felt. And so when I came back here, we all decided to say, these are the symptoms of meningitis. He's actually showing the physical symptoms of it. But all of his tests and his blood work and stuff wasn't really kind of correlating with it. So we had to make the decision to treat him anyway for it. And he responded. So that's like one of those cases that we're going through this algorithm and nothing's making sense. And then we're like, all right, well, you know what? Let's start treating anyway and see what we come up with. And it's been like a long road of recovery. And it's just not like tons of steroids and on CBD and on, phenoxybenzamine and cisapride to help him urinate and defecate properly, and rehab therapy. And it's still kind of what we have to call quote unquote open, because none of the tests can say this is definitely this problem. They're going by his symptoms of what he had, how he went ahead and responded to treatment, and where he is now.
Yes, and sometimes we have to do that because sometimes, he didn't have his CSF tap. We didn't, his lab work didn't show meningitis. And it's not an easy diagnosis. Regardless of what species you are, it's not an easy diagnosis to make. So there are a lot of cases where we never get a true diagnosis. Right. And sometimes after either a pet or a person passes away, there's no diagnosis. It just happened. And even if you do an autopsy or necropsy, you don't have a true diagnosis. So that is frustrating. But I think in general, the medical community appreciates when we can get a diagnosis, because then we know what we should do to treat it.
Right, and then also, if you have pet insurance, they want a diagnosis.
They do want a diagnosis.
They want a diagnosis. So if you wind up with these pets that have this chronic open folder of like, what's going on with you, that gets a little confusing too. So, it's just not a matter of, the veterinary community just dumping every test possible. We really are truly trying to make your pets healthy and trying to extend their life. Veterinary medicine's come so far in just like 20 years. I remember like when I started over 25 years ago, the stuff that we had, when the first SNAP tests first came out, I thought that was amazing. And now it's like you take that kind of test for granted. There's new stuff like all the time, and it makes the diagnostic a lot easier to perform. And you guys get a quicker diagnosis on top of it.
Right.
Like
so
you can have a diagnosis in 15 minutes for a FELF test.
Yes, which is phenomenal.
Or even like pancreatitis or heart disease now. We can do those little SNAP tests to kind of give us an idea of like, do we have something brewing and can we start treatment earlier?
Right. For those of you who don't know, a SNAP test is like a in-hospital test we can run on some blood. There's some for like Giardia, which is on poop, and some other tests that we don't use here because we don't have as much Giardia here because we're cat people here, and they don't go.
Kittens.
They don't. It's in kittens, but it's not like they're in a dog park, like sharing things. So
drinking the DC water fountains.
There's not as much like Giardia here, so we don't have the in-house SNAP test, but that's off of poop. But there's in-house SNAP tests, which basically you snap it like this, which is kind of fun, and we can do a lot of different diagnostics that way for certain things. So that's what Ellen was talking about for a SNAP test. Amber, are there any questions? There's no questions. I guess we were very thorough the first time, so that's
good.
Nice.
Sounds good.
Well, I hope everybody has a happy holiday and a very happy and healthy new year. And if there's any questions you have for us, or if there's any topics you'd like us to cover, let us know. Just so you know, sooner than later, hopefully sooner, we're working on it. We're going to have a podcast coming out, so keep your eyes open for that. I'm sure we will plaster it everywhere. But thank you. Have a great one. Bye.